First of all, I'd like to congratulate you for following our channel, where we aim to provide accurate information about reproductive and sexual health. I also want to thank you for taking the time out of your day to be here. Today, we're going to talk about a topic called vaginal laxity. What do we understand when we say vaginal laxity? Medically, laxity can be defined as looseness or a lack of tightness. We can describe it as a disruption in the compatibility between the penis and the vagina due to structural changes in the vagina. Sometimes, couples may notice this condition. Sometimes, they may not. The vagina has a unique elastic tissue. With pregnancy, it stretches under the influence of hormones, and during childbirth, it expands. We can think of the vagina like an accordion. It widens and opens like a bellows tube. This structure helps the baby pass through easily, or allows it to comfortably accommodate the penis. The vaginal muscles, especially those at the entrance, called Kegel muscles, and the pelvic muscles are so beautifully and perfectly created that they form a structure capable of both opening outward like a door and tightly gripping the penis inward. With all these muscle structures, we are talking about an organ that embraces the penis and contributes to the pleasure felt by both the woman and the man. So why does this natural structure deteriorate? Or how can it be repaired? Where are we going wrong? Or what are we neglecting that causes this tissue formation to break down? All the organs in our body are created to function in harmony with their specific roles. In other words, each organ operates in a way that suits its intended purpose. However, as human beings, we can disrupt this natural functioning through our lifestyle choices and the things we often overlook. For example, nutritional deficiencies, a sedentary lifestyle, lack of vitamins, insufficient exposure to sunlight, or using our bodies roughly can all negatively affect this process. Even intense or improper forms of exercise can contribute to this disruption. When we think specifically about the vagina, birth trauma can lead to a breakdown in this structure. When we talk about childbirth, we often assume it's a natural process that happens smoothly on its own. Of course, midwives and obstetricians work hard to ensure that this process proceeds in the healthiest and safest way possible. They aim to support the most ideal birth experience, one that protects the woman's bladder, vagina, anus, the entire vulval structure, and the pelvic floor. But this isn't a success that depends solely on the doctor or the midwife. The individual, meaning the woman herself, also plays a major role by caring for her own body and striving to live a healthy lifestyle. For example, gaining 25 to 30 kilograms during pregnancy is a sign that proper nutrition may not be in place, right? When the body suddenly gains that much weight, or when a woman rapidly loses weight, like going from 160 kilograms down to 80, it's only natural for sagging to occur in areas like the neck, arms, or abdominal skin. Just as such a situation might call for a body lift or tightening surgery, sudden weight gain followed by weight loss can also lead to looseness and sagging in the vaginal area. So, what other kinds of complications can occur during childbirth? Sometimes, we encounter situations where the baby becomes stuck in the birth canal. As doctors, this isn't always something we can predict in advance. We check the baby's shoulder width, abdominal circumference, and head size via ultrasound. We evaluate the mother, look at her pelvic structure, and measure the space between the bony projections. And we might say, she should be able to give birth comfortably. Hopefully, everything will go smoothly, but things don't always go according to plan. In that moment, the mother's anxiety, irregular breathing, difficulty coordinating her pushing efforts, or even the baby changing position during labor, like the umbilical cord wrapping around the hand or neck, can slow down the birth process. So, what happens sometimes? The baby is almost at the point of delivery, but at that stage, performing a C-section would carry even greater risks. That's when we may need to use certain maneuvers to prevent the baby from being deprived of oxygen, which could lead to future neurological problems or brain damage. We apply pressure from the mother's abdomen, pressing down on the top of the uterus, which we call the fundus, in an attempt to help the baby move downward. And sometimes, we use a device known as a vacuum, placing it on the baby's head and gently trying to assist delivery from below. So what happens then? The combination of the vacuum device's movements inside the vagina and the pressure we apply from above to push the baby down increases the pressure on the vagina. Naturally, even in a first-time birth, and even if the woman is only 20 years old, the outcome can sometimes be met with disappointment or sadness. You may find that the bladder has descended, the colon has herniated forward, and there are tears or openings in the vulvar area. Of course, these kinds of situations can be repaired with surgical interventions, known as perineoplasty. However, the key here is the postpartum period, the lochia, and breastfeeding stage. During the first 40 days, the body begins to recover, and it is expected to return to its former state within about 6 months. During this time, it's important for the mother to remain as active as possible, engage in exercise, and take time for herself to do physical activities, which will help her body recover more easily. After a first birth, second birth, or sometimes even a third, vaginal laxity, in other words, looseness and sagging, tends to increase. So what happens then? The penis-vagina fit becomes disrupted. Orgasm quality declines. A woman might wonder, is my partner unable to get hard? The man may feel inadequate and think, is my penis not hard enough? Should I get a penis enlargement? How can I make my penis thicker? And how can I improve the fit with my partner? The sexual pleasure and orgasm quality for both partners are achieved through the coordinated movements of both organs. So, does laxity only occur due to childbirth? When we talk about childbirth, we're referring to traumatic and difficult births. However, if we're talking about a woman who has received prenatal education, paid attention to her weight gain, walked regularly, exercised, and practiced perineal massages, the situation can be quite different. Additionally, if she can control her breathing and pushing, and if the support she receives during the birth, such as water birth, the quality of support from her doctor and midwife aligns well, the birth can progress much more smoothly and naturally. The calmness of the mother, her partner, and the family also plays a significant role in ensuring a healthy birth process. Therefore, I believe it is crucial to receive prenatal education, and that birth preparation is extremely important. Psychologically, it's important to approach the processes of breastfeeding and healthcare with awareness, free from anxiety. As a doctor, I recommend entering birth with full awareness and preparation. However, outside of childbirth, sudden weight gain and loss is also an important factor that increases vaginal laxity. Additionally, situations like traffic accidents, conditions that affect the nervous system, such as neck and back hernias, diabetes, or tumors in the bladder, colon, or uterus, can lead to changes in the vaginal structure and nervous system. These can also contribute to vaginal laxity. Likewise, deficiencies in vitamins like D, B12, and zinc can cause relaxation of the vaginal tissue. So, what other situations can lead to vaginal laxity? Sometimes the reckless use of sex toys can be a contributing factor. In other words, inserting various objects into the vagina in an uncontrolled manner, whether for masturbation, to enhance orgasm quality, or as part of sexual fantasies, can, in some cases, disrupt the vaginal nervous system. Such objects can negatively affect the structure and natural function of the vaginal tissue, potentially leading to relaxation and loosening over time. Collagen deficiencies or muscle diseases are also significant factors. Yes, the weakening of muscles, just like in the muscles of the arms and legs, can lead to damage and laxity in the vaginal muscles as well. Collagen deficiencies are particularly associated with nutritional imbalances. Consuming bone marrow, red meat, organ meats, and bone broth is extremely important. Ready-made collagen supplements can be recommended, especially for women over 50 and those going through menopause, as a supportive measure to prevent increased sagging and to avoid further laxity. Additionally, increasing the intake of zinc, leafy greens, foods rich in zinc, and red fruits are very beneficial. Fermented yogurt made from sheep and goat milk at home, milk from pasture-raised animals, and their products are highly beneficial. Salads also play a very important role in overall nutrition. Vaginal laxity doesn't just affect sexual life. Over time, issues like urinary incontinence, problems with laughing, sneezing, or urgency in reaching the toilet can emerge. In other words, the bladder's capacity can fill up quickly, creating a strong need to rush to the bathroom, and there may even be urinary leakage while attempting to go. This can lead to stress incontinence. Yes, vaginal laxity is, In medical terms, a condition that causes dissatisfaction for both women and men and disrupts quality of life. Sometimes, vaginal laxity can also manifest with damage to the vulva. For instance, episiotomy cuts made during childbirth, or tears that occur spontaneously but are left untreated, or situations where the vulvar opening is left exposed, can lead to this. In other words, leaving the vulva exposed doesn't just lead to looseness, but also increases the risk of frequent vaginal infections, cervical erosion, bad odors, the easy passage of bacteria from the anus, and infections that can be transmitted from toilets, latrines, or sexual positions. The ease with which the microbial environment of the anus can transfer to the vulva, along with frequent urinary tract infections, can lead to the emergence of vaginal infections as well. That's why, after every birth, it's crucial to reassess the body. After the postpartum period and breastfeeding, a gynecologist should evaluate both the perineum and the vaginal structure, determine which treatments are appropriate for each patient, and contribute to repairing the muscles. So, you might be wondering, how will the treatment be? For this, it will be much more beneficial for you to watch another video we've made on the topic. If you find our work and videos useful, sharing them with your loved ones and tagging them on various professional platforms and social media will help spread this information to more people. Stay healthy, live happily, and goodbye.